Hi, my name is Dr. Sheikh. May I know your name and your age, please?
Yes, it's Catherine, and I'm 27.
And how may I address you?
You can call me Catherine.
Okay, thanks, Catherine. I saw that your GP has referred you because you have got Marfan syndrome and you've been keen to conceive. Is that correct?
That's right, yes. I've got Marfan syndrome, yes.
Is there anything in particular you want me to address? You just want to know about the suitability of pregnancy in your situation?
Yes, the thing is, you would like to have family actually, so you're interested in that, but is there any effect of Marfan's on my baby and whether this could be transferred to my baby or not? I just want to know about that.
Okay, sure. We'll address that. I'll be happy to help you with that. Now, would it be okay, Catherine, if I ask you a few questions before I answer your questions, and then I'll give you some written information and some website addresses. If there is anything that you don't understand, you can interrupt me and ask me, or ask me in the end. That should be fine. Would that be okay?
Yes, that should be fine.
Okay, thank you. So, have you ever been pregnant before, Catherine?
No.
And when were your periods? 10 days. 10 days.
10 days back, actually.
Okay, thank you. And are they regular?
Yes.
And so 28 day cycle?
Yes.
And how many days do you bleed?
3.
And bleeding is normal, not heavy or anything?
Usually no, yes.
Okay. And is there any problem with your sexual relations? Any pain or anything?
No, no problem.
Any bleeding after the sexual intercourse?
No.
And how about your cervical smears? Have you been doing so you must have had one cervical smear, isn't it?
I had one, yes.
Okay. Is it has it been normal?
Well, they never said anything
So, okay, good. So, and are you using any contraception at all?
Yes.
What is that?
Condoms.
Okay, so that may need changing actually, because I know you are here because you're wanting to conceive, but until we are sure that you are okay to go ahead with that, we should switch you to a better contraception that has a better reliability, because condoms, they've got a high failure rate. Would that be okay?
Yeah, it can be a problem. Yeah.
Okay, so I'll write to your GP to offer you other contraceptions, okay? And any gynecological issues at all?
No.
Any surgeries on your tummy or in your pelvic area?
Oh, I had a hip replacement a few years ago.
Okay, hip replacement. Okay, how is it going?
It's fine, no problem.
No problems there. Okay, good. And do you have any other medical condition at all?
No, just Marfan. That's it.
Okay. Tell me about your Marfans and how well are you coping with it? So tell me about your Marfans, how well you are coping.
So I get breathless when I go up on the stairs actually. And
okay.
I've been diagnosed with high blood pressure recently, and I've been starting on some medications.
Okay. So that's not good, isn't it? So because we're wanting to make you fit as soon as possible for the pregnancy. I've noticed that the blood pressure medication that the GP has given you, if you're planning to become pregnant, we will ask them to change those to some medication that are suitable for pregnancy. Now, at the moment, we should focus on making you, optimizing you for pregnancy. So, as far as your breathlessness is concerned, that I can see that they did an echo on your heart. Did they do an ultrasound on your heart, Catherine?
Yes, scan.
Yeah, okay. So, did they tell you anything about it? What was it?
The doctor would tell me.
Yeah, okay. So what happened is that your GP has written to me that there is something that is called the root of aorta. Aorta, is the biggest blood vessel that carries the blood from your heart to all of your body. And the root of the aorta in Marfan syndrome, it is vulnerable to start getting too much stretchy and too much big or dilated. That is a risk factor if you become pregnant with that, there is a very high risk of rupture of that part of the blood vessel.
Right.
And that can be a risk to your life. So we need to optimize that first. What we need to do is, I'll write to your cardiologist, and I'll copy the cardiothoracic surgeons into this. Cardiothoracic surgeons are the heart surgeons, okay? So they will sit together and they will decide whether they want to intervene at this stage, do any operation or any surgery or not on your heart, okay? Once if, for instance, they do a surgery and they make you fit, after that, you will be able to better cope with the pressure of the pregnancy. Do you get what I'm saying?
Right. So does that mean you need surgery then?
So I will not be able to give a verdict on this, Catherine. It will be outside my field of expertise. It will be your cardiologist and your heart surgeons who will tell you. But for me, what I'm trying to say is that the reading that was obtained on the ultrasound of your heart is not very reassuring. And those are the people who need to see you and decide, okay?
Right.
So what I will do, we will look into controlling your blood pressure, very strict control of your blood pressure, and I will write to them, to your cardiologist and your heart surgeons. And coming to your question of, now this is like your situation. So that if you become pregnant, what can happen? So this is what can go wrong. That your system your body will have to cope with much more pressure, much more fluid, because it increases in the pregnancy, and that can affect your heart, and that can weaken, and there is a risk of rupture. Now, coming to your baby, there are risks with the baby. There is a 50% chance that your baby will inherit the condition. Okay, is your partner screened for Marfan's at all?
Yes.
He's not. He's not a carrier. Okay, he's not. He hasn't got it. Okay, good. So in that case, it will be a 50% chance that your baby will have Marfan syndrome.
So will my baby be affected? Is there any way we can find out whether the baby is going to be affected or not?
Yes, there is actually. So there are two ways to go ahead with that. One is, if you conceive naturally, we can offer you a test which is called a needle test at around 11 weeks of pregnancy. So there are two types of needle tests. One can be done early, and one has to wait for at least 15 weeks. So we can always aim for the first one that can be done early, around 11 weeks. That in that we take a tiny piece of the afterbirth from around your baby, and we analyze it in the lab. That will show whether the baby has Marfan's or not. But that is an option where you have to undergo the trauma of thinking of termination of the pregnancy, or dealing with the situation, then like carrying on with the pregnancy with the Marfan's baby, which is, of course, I understand, very stressful. The other option is that there is an option of pre-implantation genetic diagnosis. That is actually something that can be done through if you go ahead with an option of the test tube baby. In that situation, your baby will be tested before being replaced in your womb. And if an embryo has got Marfan's, then they will use the embryo that hasn't got the Marfan. Does that make any sense?
Yes.
Okay, great. So we can talk about whether you're going for IVF or not once you are fit for going ahead with the pregnancy. So now let me sum it up for you. If you agree, I'll contact all the team, like the cardiologist and the cardiothoracic surgeons and the GP, and involve my consultant to optimize you for a healthy pregnancy. I'll discuss with my consultant and make this plan, and we will write to the cardiologist to have their view on the current situations, and to request them to control your blood pressure, and to liaise with the cardiothoracic surgeons. I will write to update your GP about all this, and I'll prescribe you folic acid and request blood tests to screen you for the rubella immunity. And if you are not immune, then we'll ask your GP to vaccinate you. If you get vaccinated, then you will need to observe strict contraception for 1 month at least. Now, since this situation is so stressful, would you we are happy to refer you for counseling and support if you wanted that. Would you like to get some counseling and support?
Yes, please.
Okay, great. I will do that for you. And I would like you to know that if you become pregnant, your pregnancy will be taken care by the consultant-led team and a multidisciplinary team of doctors, okay, involving the physicians and surgeons and us, okay? And if the fertility team was involved as well, then of course they will be there in the beginning to, oversee the complications, any possible complications of the IVF pregnancy. Any questions at all?
No, thank you.
Okay, great.